All right, this is Ubaid on behalf of Electronics, and in this video, we'll be talking about blood and urine test. Okay, now you can use your blood and urine test for different applications. It could be because you need it for employment, it could be because you need it to drive, okay, so on and so forth. It could also be to check for your health. Okay, so when it comes to blood and urine analysis, this is what your blood test result looks like. Okay, you have your WBC, okay, your neutrophils, your lymphocytes, okay, so on and so forth. Okay, so starting with WBC, your white blood cell analysis. This is part of complete blood count. CBC checks the number of white blood cells in a blood sample. Okay, now these white blood cells are important for the immune system. Okay, and that's the reason why they're important when it comes to fighting off infections and disease. Okay, the WBC count can help diagnose infections, inflammation, and other conditions. Okay, normal range anywhere between 4,000 and 11,000 cells per microliter of blood. Okay, so you can see the reference number over here. This is your reference value. This is considered normal by the lab between 3.2 to 9.4, and the result is 6.8, for example, which is considered normal. Okay, it's because it's between the two values over here. All right. So normal range can vary between 4,000 and 11,000 cells per microliter of blood. Okay, why is a WBC count important? Elevated WBC count can be a sign of infection, inflammation, or other conditions that require medical attention. Okay, monitoring conditions can be used to monitor effectiveness of treatments for certain conditions like infections and leukemia. All right. So next up, you have neutrophils. Okay, so neutrophils, okay, this is a key part of a complete blood count. Checks the number of neutrophils in a blood sample ranging between 2,500 and well, 7,000 rather per microliter in healthy adults. Can help check for various conditions like infections and inflammation. All right, now why is it important? Diagnose infections, monitor treatment, assess overall health. Okay, what is a normal neutrophil count? It ranges between 2,500 and 7,000 neutrophils per microliter of blood. Okay, what does it mean if it's outside the range? Okay, high neutrophil count suggests infection, inflammation, stress, or other conditions. Okay, low neutrophil count can narrow issues. Okay, severe infection or response to certain medical treatments. Okay, what does it mean if the neutrophil count is outside the normal range? High neutrophil count basically shows an infection, inflammation, stress, or other conditions. A low neutrophil count shows bone marrow issues, severe infection, response to certain medical treatments. Okay, so how is this performed? CBC, ANC, bone marrow biopsy. Okay, lymphocytes. Okay, lymphocyte analysis basically involves examining white blood cells called lymphocytes, crucial for immune system to check their levels and types. Okay, what are lymphocytes? Lymphocytes are basically types of white blood cells that play a vital role when it comes to body's defense against infections and disease. Okay, they're basically produced in the bone marrow, can be found in bloodstream, lymph nodes, okay, and other tissues. Okay, why is this analysis important? Identify infections, check for autoimmune disease, diagnose cancers, monitor treatment, so on and so forth. Okay, how is this analysis performed? Blood tests, CBC, okay, flow cytometry, and other tests. Okay. Monocytes, okay, monocyte analysis basically involves checking or assessing the levels and characteristics in blood samples through a CBC, okay, to check for disease and infections, autoimmune disease, blood disorders, so on and so forth. Okay, so again, monocytes are another type of white blood cells. They deal with the immune system. Okay, so when it comes to analyzing monocytes, it may be done using CBC, complete blood count. Okay, absolute monocyte count. Okay, flow cytometry. Okay, what do the results mean? Okay, high monocyte count, okay, can indicate infections, autoimmune disease, or blood disorder. Okay, on the other side, the low monocyte count may be associated with certain medical treatments or bone marrow problems. Okay, normal range, anywhere between 200 to 800 per millimeter cube. Now, this may vary between lab results. You may check your reference values for your lab results to check your normal range. Okay, next up you have eosinophil analysis. Eosinophil analysis involves measuring number of eosinophils, type of white blood cells in a blood sample. Okay, why is it important? To identify allergies, detect infections, assess certain cancers, monitor disease progression, so on and so forth. Okay, how is it performed? CBC, absolute eosinophil count, bone marrow biopsy. Okay, basophil analysis. Okay, what are basophils? Type of white blood cells, part of the immune system. Okay, normal basophil count, typically 0.5% to 1.0. Okay, usually measured as part of a complete blood count, CBC. All right, so on and so forth. Conditions, allergic reactions, chronic inflammation, autoimmune disorder, okay, low basophil count, acute infections, hyperthyroidism, so on and so forth. Okay, blood tests, RBC, red blood cell analysis, often part of CBC, measures the number of red blood cells in your blood, essential for carrying oxygen. Okay, what does it help diagnose? Anemia, bone marrow disease, kidney disease, certain types of cancer. Okay, normal ranges for men between 4.7 to 6.1, women 4.2 to 5.4 million. Okay, children 4.0 to 5.5 million RBCs. All right. What can help diagnose anemia, bone marrow disease, kidney disease again? Okay, this is basically to check for uh, disease like anemia, sickle cell disease, okay, and so on and so forth. Okay, so analysis is a process used to separate and identify different types of hemoglobin in a blood sample. How it's done, okay, through HPLC, capillary separation, so on and so forth. Okay, results normal. All right, so when it comes to adults, okay, the primary hemoglobin type is HbA between 95 to 98%, smaller amounts of HbA2 between 2 and 3%, and HbF rather, less than 1%. So hematocrit analysis is also known as a packed cell volume PCV test. Okay, what it measures the proportion of red blood cells in the total blood volume. Okay, how it's performed. Okay, blood sample is drawn and the red blood cells are separated from the other components of the blood. Okay, what it indicates: low anemia, okay, high hematocrit, so on and so forth. MCV, this is your mean corpuscular volume. Okay, this is part of complete blood count. CBC measures the average size of red blood cells. Okay, what is MCV? This is lab value that measures the average size and volume of red blood cells, RBCs. Okay, why is it important? Anemia diagnosis. Okay, factors that affect MCV, age and gender, certain medical conditions, medications, diet, so on and so forth. Okay, platelets. Okay, platelet analysis, platelet count test measures number of platelets, thrombocytes in your blood. Okay, why is platelet count important? Okay, diagnose conditions, monitor clotting disorders, so on and so forth. Okay, what if platelet count is high? Higher than normal platelet count, increase the risk of blood clots or stroke. Okay, PT analysis, this is a prothrombin time test. Okay, has to do with an international normalized ratio, INR. It checks how quickly blood clots, specifically focusing on the extrinsic and common pathways of the coagulation cascade. Okay, so what does it measure again? Okay, it measures the time it takes for the blood to clot, which is then used to calculate the INR. Okay, when is it used? To monitor the effectiveness of anticoagulant medications. Okay, so medications, anticoagulant medications, to assess bleeding or clotting disorders, to check for liver function, okay, so on and so forth. INR analysis, this is a blood test that measures how long it takes for the blood to clot, okay, You've got the normal INR range, okay, between zero point 0.8 to 1.2. Okay, and it helps the doctors check for the effectiveness of blood thinning medications. PTT analysis checks how long it takes for the blood to clot, assesses the function of intrinsic and common pathways of the coagulation cascade. Okay, why it's done to diagnose bleeding and clotting disorders, monitor a certain type of therapy, evaluate coagulation cascade. Okay, what do the results mean? Normal PTT ranges between 25 to 35 seconds. Okay, prolonged PTT may indicate deficiencies in clotting factors, presence of inhibitors, use of different kinds of medication, okay, liver disease, vitamin K deficiency. Okay, next up you have urinalysis. Okay, so this is a separate result from your blood test. Okay, for your urinalysis, some of the terms that you're looking for are as follows: glucose, okay, bilirubin, okay, ketones, specific gravity, blood pH, protein, okay, so on and so forth. Okay, so when it comes to urinalysis, visual examination of urine checks for its color, clarity, and unusual odors. Okay, color, normal color, ranges from pale yellow to a darker amber. Clarity, healthy urine is typically clear. Odor, fresh urine, okay, has a mild characteristic odor. Okay, cloudy urine can check for cells, bacteria, or crystals. Okay, dark yellow or amber urine can suggest dehydration. Okay, red or brown urine can check for blood in the urine. Unusual odor can point to infections and other conditions. Okay, so urinalysis glucose test, also known as urine glucose test, checks for the amount of sugar in your urine, common part of urinalysis. Okay, what it measures, test checks if the glucose in the urine, which is called, okay, glycosuria. Okay, why it's done, diabetes screening and monitoring, kidney problems, and other conditions. Okay, what the results mean: normal, little to no glucose should be present in urine. Abnormal, presence of glucose in urine can indicate high blood sugar, kidney problems, okay, certain medications. Okay, bilirubin, this is a yellowish pigment that's a byproduct of red blood cell breakdown. Its presence in urine is abnormal, can indicate liver or bile duct problems, okay, so on and so forth. Okay, positive test means that bilirubin is present in your urine, which can be a sign of liver or bile duct problems. Okay, ketones. Okay, ketones are produced when your body breaks down fat for energy instead of glucose. Okay, why measure ketones? Okay, diabetes, other conditions, monitoring. How is it tested? Urine dipstick test, lab test, so on and so forth. Okay, specific gravity measures the concentration of solutes in urine, checking the kidney's ability to concentrate urine. Okay, now how is it measured? Can be measured using a dipstick or more accurately through lab analysis. Okay, clinical significance. USG helps healthcare professionals assess kidney functions, evaluate hydration status, detect potential problems like diabetes, can monitor patients with kidney disease. Urinalysis can detect blood in the urine, also known as hematuria, can indicate various issues like urinary tract infections, kidney problems, and even cancer. Okay, what can cause the blood in the urine? Okay, urinary tract infection, UTIs, kidney problems, bladder problems, and other conditions. pH, normal urine pH ranges from 4.5 to 8, with typical range of 5.5 to 6.5. Okay, factors affecting urine pH: diet, hydration, kidney function, medication, infection, so on and so forth. Okay, what to look for: normal pH between 4.5 to 8. High pH, okay, can be associated with conditions like UTIs, kidney failure, and certain dietary factors. Okay, low pH can be associated with conditions like dehydration, diabetes, or certain respiratory disease. Okay, urinalysis, protein. Okay, so protein, when it comes to protein, it can indicate kidney problems or other underlying conditions. Okay, what is proteinuria? Okay, is the presence of abnormally high levels of protein in the urine. Okay, what can cause proteinuria? Kidney problems, other conditions, temporary causes. How is it detected? Urine protein test, 24-hour urine collection. urine protein creatinine ratio, UPCR. Okay, what are normal values? Random urine sample, 24-hour urine collection. Okay, what does it mean if I have protein in the urine? Small amounts of protein in the urine may not be a cause for concern. Persistent or increasing amounts should be evaluated by a healthcare professional. Conditions. Okay, urobilinogen. Okay, this is a colorless pigment produced in the gut from bilirubin metabolism. Okay, with some excreted in feces and the rest absorbed or reabsorbed and excreted in urine. Okay. Formation formed in the intestines by bacteria breaking down bilirubin, a byproduct of red blood cell breakdown. Okay, metabolism excreted in feces, oxidized to, okay, this is your stercobilin. All right, urine test. Okay, so urobilinogen in urine is a normal finding. Elevated levels may indicate liver disease, anemia, okay, or other kinds of obstructions. Okay, and your normal range would be anywhere between 0.1 to 1.8 milligrams. Okay, now it may vary depending on your lab results. Okay, you might want to check their reference values. Okay, nitrite. This is a positive nitrite result where bacteria converts nitrates to nitrites. Okay, in urinalysis, checks for nitrites, examines urine for various substances, including cells, chemicals, and other indicators of health. Okay, what are the limitations? Not all bacteria can cause UTIs. Okay, can convert nitrates to nitrites, so a negative result doesn't necessarily rule out a UTI. Okay, what if the test is positive? The nitrites are present, your doctor may prescribe antibiotics to treat the UTI. Okay, leukocytes, okay, can check or indicate a urinary tract infection, UTI, or other inflammatory conditions. Okay, what are leukocytes? These are white blood cells, part of the body's immune system, produced in the bone marrow and found in blood and tissues. Okay, normal versus abnormal results. Normal, small number of leukocytes, 0 to 5 per microscopic field, considered normal. Abnormal, high number of leukocytes can indicate a UTI, kidney problem, or other conditions. Other possible causes, kidney stones, inflammatory conditions, tumors, certain infections, so on and so forth. Okay, microscopic exam. It involves examining urine sample under microscope to identify cells, crystals, and microorganisms. Okay, what it looks for: cells, crystals, casts, microorganisms. Why it's done: diagnose conditions, confirm findings, monitor disease progression. Okay, so on and so forth. All right, so that's it for part one of your urine and blood test analysis. Okay, we'll continue this with another video. Okay, for now, this is Obaid on behalf of Electronics. Have yourself a great day.